Okay, this is a 71-year-old male that has a history of migraines from, about 40 years or whatever. And when he came to me, he'd probably be suffering from excruciating migraines about 70 to 80% of his waking hours. Um, yeah, he's taking an antihypertensive med, I think lisinopril or something like that. Um, yeah, his lipids are not high enough that I wouldn't put him on statin, but he was on a statin. His back, knee, neck pain is not too bad. He's had fibromyalgia for years, but the biggest issue is his migraines.
Okay, so migraine is a pretty straightforward, in most cases, occasion. So here you can see the causes of the migraine. So we're going to go through, this is a very good case. So we see that the thermogram is good. This has come down on the glabellas, which bring up the question of how far down. These don't come 1.2 degrees below the first reading, so it's an okay thermogram. If you want to make it a little bit better, the room might be at 70 or 71 or even 72.
Warm it up a little bit. The patients would like that.
Yeah, make sure that the patients are not directly on a hard floor so that they don't get coldness generating upward. So you should put down a towel or
The room,
blanket.
the room is carpeted. It's not a
Yeah.
thick carpet. We can put down a towel.
Um, we just don't want them on tile or something. So
No, no
as we
tile.
as we look down the thermogram, we look for the black spots and see we have 15% in the neck, so it's not significant, even though we have some different things happening there, and we have this overall warmth. But we do see blocked regulation in the chest at 28.6. It's significant. And we see it on this left heart point, almost on this left heart point, and on this right heart point. So this is more, it could be bronchial or pulmonary. Um, it's very difficult because when you see there's blocked both sides, it's more pulmonary. But when you see the right side is normal and the left side is abnormal, this is more of a really clear cardiac, the muscle of the heart, myocardium problem.
Say that again.
See how this right heart point is normal regulation
Right.
and the left is blocked? Since the heart lies mostly on the left side, then this is an indicator of heart problems. If it were lung, it would be both of these would be blocked, symmetrically blocked. But when you see only one side being the right side normal and the left is abnormal, it's more of a cardiac suspicion. When you see this, the next is the cold stomach. That's a sign for intestinal fungus or hydrochloric acid deficiency. But here we see the migraine. Here's the migraine picture. Remember what we said about these cold pancreas points?
Okay.
That's insulin resistance. And the first one is enzymes. So we have an enzyme deficiency, insulin resistance. And look, this gallbladder point is normal, but these liver points are hyporegulating. We don't even want the liver to be hyporegulating. We want it to be blue, normal regulation. So this is pancreas liver conglomeration of metabolically generated migraine. We do have a food intolerance of the appendix and the small intestine coming down below all the rest. So there's a food allergy as well, which can create migraines. The prostate's almost blocked. There's a little bit of a back asymmetry the cubital fossa are symmetric but blocked on the right, which is, um, so we're going to want, it's almost blocked on the left. This is more of a circulatory problem. Does this guy get cold hands and feet?
Not that I recall.
I see a thyroid is going the wrong way, so a little hypothyroid. Anything strange about these teeth? Well, these both sides look the same, almost the same, but these two sides looks like it gets a little too cold in here, almost the same, but something is blocked here in the front. So, and then here's the heavy metal signature. The heavy metal signature is areas 3, 4, 5, and 6. That's the chest, upper abdomen, lower abdomen, and back. If there are blocked points in the chest, upper abdomen, lower abdomen, or back, that's an increasing case for heavy metal toxicity. And here, this guy has 2 out of 4. So there's some indication for heavy metal toxicity. So you look at these 4 regions, the chest to the back, and if there are block points in each of them, and this tells you that in this rigid column, then you can then know to do heavy metal testing to confirm it. In the jaw, we see a side difference of just a little bit in the upper, 0.3, and only 0.2 in the lower, so there's no big asymmetry that we thought we might be seeing in the mouth, but we're going to let the dental section dictate what's wrong. This appendix coming so cold and then almost staying the same could mean an appendix focus, which is one of the internal anatomies that can produce a field that generates to the rest of the body and facilitates the immune system to be overactive. But the major core of the problems here is in all of this almost blocked regulation and the pancreas. And you have to utilize your own knowledge of migraine to be able to depict. Migraine can be metabolic hormones, it can be metabolism with enzymes, it can be gut related, or it could, those are the most common. And we see both, some of the gut, but we really see this pancreas and liver as being major. So now let's look at the report. Now that we carry on those ideas, and you don't even have to have that much on that I said. So here's that minimal heavy metal, and here's some adrenal stress that doesn't tell us a whole lot. And then we have a sinus problem possible, and then we have a little bit of lymph. Remember, we didn't see that much in the neck. And then we have this hypothyroid. Does he have a normal thyroid from what you can tell from your tests? Or you don't
Um,
know?
I don't remember.
So here's the severe insulin resistance. So the report shows you what could be the cause, and I believe to be the cause of the migraines, and the food intolerance. So we have, those are the 2 severes. You'll notice those are the 2 severes, and so they're listed here in the priorities. So this did a really good job of vocalizing the dysregulation patterns. And as we see this, you can show this to the patient. These are the blocked areas that we want removed. We suspect something still could be wrong on the right side of the body somewhere. That may be this liver. You see how this is hyporegulating and it's a different color?
Hmm.
So I would want to I use Chinese herbs and normal nutraceuticals with things like milk thistle and chelidonium and uh, dandelion. You should tell them to eat tons of artichokes. And then here you have 2 speckled teeth. And what are the speckled teeth? Large intestine. So all of these are large intestine. So, and then of course there was that right chest. Does he have any lung symptoms?
No.
So Um, and he's on lisinopril for
Right.
hypertension, and that's effective.
Somewhat.
It looked like it is because if it wasn't, this radix nasi point would be up here. So these both of these points would be high if his hypertension was overriding the pharmaceutical. You notice that he has a little bit of the asymmetry in the ethmoids showing virus. So there's a little bit of a background virus, but the way to undo the migraines is very clear and delineated in the report. Now, of course, we can go back and just kind of reconfirm and look at different parts. And I think that these teeth will become unspeckled when you really spend a lot of time treating the integrity of the intestine. We also want to
Okay.
see, does anything here relate to uh, uh, the cholesterol problem? Are you going to take them off of the statins?
I already have.
Okay. So you want to see if any of that's related. So then you treat the pancreas and liver, and it should be the answer to the cholesterol. I would be curious to see what's here in the teeth, but I think that the body is reflecting up to these teeth because they're identical teeth, and he doesn't have too much uh, uh, that's really significant in coming out, except for in these in the pancreas and liver, uh, which and the intestine, which correlates with this. So I would treat them for a month and then redo the thermogram, and those teeth should clear. If they don't clear, then you should look at the teeth. Here's the dental index, but he only has 3 out of 9 causing stress to the prostate, so there's no reason here to suspect anything. The
I,
adrenals, of course.
he does have increased nocturia, and he was on Flomax, but that was I forget what the side effect he was having from. So he's off of that, and he's on some prostate supporting herbs.
Okay. Um, what I don't like about this prostate is it's in hyporegulation, so it's almost blocked. And so I would treat him with I'd like to make a suggestion. Those of you who use Sanum therapy, uh, the the Aspergillus niger, or Nig from this as a suppository to get into the pelvic circulation is
Okay.
a great treatment to unblock the prostate. There's minimal stress to the prostate, yes, but uh, didn't come up with a hypertrophy because the signature for that is hyperregulation in the prostate. This is more like 10 years from now could come up with other prostate problems. Um, so we have just the clarification of the signatures. There's some sinus problems. You can look at the thyroid. There's the head emphasis, as we know, and then the most important answer to the migraine is right here in these two severes. So this is what I believe in this case without seeing them or looking at them. That's what I would, from a distance, go for with my
So
limited
how
knowledge.
do you know those two things are what relates to the migraines?
Well, because there's only a few things that cause chronic migraines besides structural
Okay.
abnormalities, which wouldn't be migraine. They're
Okay.
almost always related to either hormone or hepatic metabolism.
Okay.
So most of my migraine patients, you go for the gut and the liver, and they're solved. They go
Okay.
down to once a week, and then twice a month, and then once every 3 months, and you get some very, very, uh, if I set up, I think, uh, 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 if I set up a migraine clinic and all we would need is a couple other things like osteopathy, we could make millions. It's not, I'd like to see one that I couldn't touch at all because I don't think I've ever seen one that's cooperative and compliant uh, who I haven't been able to help.
So where says the liver part of it showing in the insulin resistance?
No, it's showing in the hyporegulation in the liver, which you see has this funny color here,
Okay.
and it's
So
showing where
that's not showing on the bars then.
here it's hypo. Do you see these liver points
Right, right.
are
But I mean
hypo?
on the signatures where you've got, severe, moderate.
Hepato, yeah, hepatobiliary, it's just below the line. It's just below the line. So, you have to make your cutoff with hyporegulation, uh, really with something that's purely liver. I'd want to see a blocked regulation. It might have uh, been, truly blocked, and then something made it a little bit less blocked, but you can see it from the thermogram, and that there
So
is
you're
it's not
seeing it on
normal.
the thermogram, but not on the
Yeah,
on where it
perhaps
says
we can
severe.
we we have a few little tweaks to the system that we can do. Perhaps a case like this, could be on the minimal hepatobiliary. Um, you know, if it's in perspective of the patient, like you can never leave your looking at your patient in front of you and say, oh, one test should show everything that's wrong,
Right.
because it's never the case in medicine. So you do have to use your knowledge base to make your final conclusions. But if you didn't know, if you were just looking at this and you didn't know, and you just treated enzymes alone, along with regulating glucose, are going to take a load off the liver. So,
Okay.
so you could try that. I just like to get all my patients better as quick as possible, and not,
Right.
and shotgun them so they feel better tomorrow instead of in a couple of weeks.